Nearly all of my patients are afraid of going under anesthesia for surgery, especially in the hours and days leading up to it. And nearly 1 in 5 patients will cancel elective surgery out of that fear alone. And since you don't know what you don't know, I'm going to share with you the most important things that you should do and should not do based on my experience guiding over 10,000 patients through surgery. And knowing these supplements, medications, peptides, and recreational drugs that you should or should not use before surgery is critical to you having the most comfortable, safe, and effective surgery. You should always discuss changing any supplements, medications, or peptide stacks with your doctor before surgery because there can be serious surgical complications. With that said, patients should always be mindful of these key guiding principles to enhance your recovery from surgery. First is protein, which is going to be 1.5 to 2 grams per kilogram per day, which might be much higher than what your normal baseline intake is when you're not trying to heal from surgical wounds. Remember that the faster your wounds heal with that protein substrate, the less pain you're going to be in. And you need to have the right amino acids to support that new collagen formation, so that means having enough glutamine and arginine in that protein intake. Next is coenzyme Q10, or CoQ10, which is a naturally occurring compound that's vital to your mitochondrial function, or the powerhouse of the cell. Multiple studies have demonstrated that preoperative supplementation with CoQ10 can minimize the risk of post-operative complications like atrial fibrillation. Not everyone needs to supplement with CoQ10, but some patients are at higher risk of heart problems than others from the stress of that surgery, and I just monitor blood levels to track the right dose in these patients. And then we have zinc, which is essential for wound healing, especially in the skin. And some patients might not be getting enough zinc from their diet alone, especially as requirements might increase as you're healing from the surgical wounds. And the same goes for magnesium, but it's doubly important because magnesium may also contribute to pain relief. And some patients might not be getting enough in their diet, and we might need to supplement higher than baseline needs with magnesium as well. But you should always talk to your doctor because your kidney function will determine the maximum dose of magnesium that's safe for you. Next is arnica, a fascinating plant because homeopathic doses have been shown to reduce bruising after surgery. I used to not believe this data because I didn't think these doses would be high enough to affect anything, but enough patients have come back to me telling me that they had a positive experience with arnica, and I've linked the data below. Vitamin D has also been somewhat controversial in terms of the ideal level, but I don't take chances in patients before surgery. I want them to be in the middle and maybe the upper end of normal range so that we can ensure enhanced muscle and functional recovery after surgery. I'll link those studies below as well. Aromatherapy is also a fascinating and safe intervention where inhaling these essential oils can help reduce anxiety and nausea in many studies. The best researched essential oils are lavender, ginger, and peppermint, and they're often safe to infuse and inhale even when you're in the waiting room for your surgery in those anxiety-provoking last couple of minutes or hour. As a pro tip, you can also use it after surgery to help with the potential nausea from anesthesia. And then there are several supplements that can help reduce post-operative pain, but you need to discuss these with your surgeon specifically because some of them can increase the risk of bleeding, which can be fatal or catastrophic after surgery. The first is bromelain, which is extracted from the pineapple and can have anti-inflammatory and hence pain-relieving effects after surgery. Omega-3 fatty acids are also a little controversial. There's mixed data about how much the anti-inflammatory effects can help reduce post-operative pain. I'll follow the blood biomarkers and treat as necessary depending on the bleeding risk associated with the surgery. And then there's curcumin, derived from turmeric, which is the darling of the anti-inflammatory supplements. But once again, you have to talk with your surgeon to make sure there's not going to be a bleeding risk with this. And then there are certain medications that you want to take specifically before surgery because of the cardiovascular effects of the surgical trauma, which put a load on your heart. Specifically, if you're taking beta blockers, we want you to typically continue the beta blockers so that your body does not go into beta blocker withdrawal during the sensitive surgery period. Those withdrawals can make your blood pressure and heart rate more volatile during surgery and anesthesia. You also need to take control of your mental health before surgery because the risk of postoperative depression and anxiety is very real, and that can diminish your surgical outcome. It can increase your risk of complications like infections, and it can delay your wound healing. And I want your cup to be filled before the stress of that traumatic surgery, which is invariably going to empty that cup. And it's also critical to tell your anesthesia team about any history of PTSD because that might reveal under surgery anesthesia, and we can take precautions by using specific medications and techniques to minimize the risk of complications like postoperative delirium in these patients. Your mental health is incredibly important, and it actually reveals even when you're unconscious having surgery. So please meet with your mental health professionals before surgery so that you are optimized before going under. And then there's sleep, which is critical to the recovery process, and surgery and anesthesia will disrupt our normal circadian and melatonin rhythms. Melatonin supplementation is generally regarded as safe, but please discuss with your doctors before and after surgery. And then there are peptides. They're a gray area, even though there are so many anecdotes of certain compounds like BPC-157 improving our surgical recovery. But you need to discuss these with your doctor first because there's a lot of variation in quality, especially as the United States FDA has banned many of these in sterile injectable form. There are oral formulations of some of these peptides, but robust data is still lacking on their efficacy. So it's a very individualized decision with your doctor. NAD+ is also a special case. There are very few formalized studies here, but there is so much anecdotal data and evidence of it helping enhance pain and functional recovery, especially cognitively, from surgery. As always, it's individualized to the patient, and you need to speak with your doctor first to see if it's safe for you before or after surgery. Lastly, honey and licorice root can help soothe the sore throat from surgery from the pesky breathing tube that we need to place to support your breathing when you're under anesthesia. That sore throat usually dissipates pretty quickly after surgery, but if it lingers, these are two powerful tools that can often help it go away faster. Have you tried any of these supplements before? Let me know in the comments below so others can learn from your experience. Remember that it's very important to work with your doctor to identify a safe brand and the right dose so that we can minimize the risk of contaminants or other complications that the wrong supplement can cause in patients. I've seen contaminants wreak havoc in patients during surgery, and I don't want that to happen to you. So if you're learning something new, hit that like button and visit my clinic's website at www.claris-health.com to learn more. And then there are some compounds that you should not take before surgery, but you should always discuss this with your doctor before surgery as well. The first are GLP-1 agonists like Ozempic. This is a gray area because they can theoretically cause a backup of food in your stomach. And that backup of food can be catastrophic if you vomit that food up when you're under anesthesia and can't cough it up safely. It might go into your lungs, and that stomach acid can burn your lungs, what we call aspiration. While guidelines are still evolving, most anesthesiologists still prefer their patients to be holding off on GLP-1s for about a week before surgery. This recommendation is still controversial though, so you need to discuss it with your doctor first. And by the way, this is the same reason you should not eat or drink anything within that pre-surgery time window so that there isn't food or acid in your stomach that could go into your lungs. Sneaking in a snack before surgery might just be your last, so please just don't do it. Another medication is a class called SGLT2 inhibitors. A common version is called empagliflozin or Jardiance here in the United States. These should be held before surgery to minimize the risk of ketoacidosis, which can happen with the prolonged fasting before the stress of surgery. As always, talk with your doctor first though. And then there's cannabis, which is a big deal for my patients here in San Francisco. There are many ways that cannabis interferes with anesthesia and surgery. It can affect nausea and pain, but maybe most importantly is change your anesthesia requirements. And if your anesthesia requirements are much higher than your weight would suggest, you run the risk of being underdosed and potentially being somewhat awake or aware during surgery. And the best time to stop using cannabis depends on many factors, like how often you use it and whether you use edibles or you smoke it. So talk with your doctor about finding the right cannabis plan before surgery. Stimulants like methamphetamines or cocaine should never be used before surgery. They can cause volatile swings in heart rate and blood pressure that can be lethal. And I've had to cancel more than one surgery because someone was illicitly sneaking in stimulants before going under. You should also hold off on alcohol before surgery, ideally for a couple of weeks. Alcohol intake affects your anesthesia dose, similar to cannabis. Alcohol also has blood-thinning properties and can lead to worse bruising after surgery, which might be problematic, especially for cosmetic appearances after you come out. And lastly, smoking cigarettes. Please stop smoking as soon as you can before surgery. Every day you hold off on cigarettes, the better the chance of having optimal wound healing and less obvious scarring after surgery. Not to mention how it's safer for your heart to not have nicotine in your blood. Please share what you've learned with loved ones and let me know in the comments below what else you want to learn about to optimize your health before surgery. Remember to visit my clinic's website at www.claris-health.com to learn more and hit that like button and subscribe to keep up with all of my medical content. Remember that you have more power over your health than you've probably ever been told.